you?
Oh, I'm so happy to be here.
Yeah, I'm so happy to have you here too. We're going to focus this chat all on hormone health, menstruation, all things period. Why don't you introduce yourself to all of the dancers that are tuning in?
Absolutely. My name is Randi Goldman. I am what's called a reproductive endocrinology and infertility doctor by training, which means that I am a specialist in all things fertility. That includes things like period and hormone health as well. I work in New York. I did my training at Harvard, and I'm the program director of our fellowship. So teaching is a really big part of my day-to-day life.
Awesome. Awesome. Thanks, Randy. So talk to me about when you feel, and I don't know if this is something that you feel is objective or subjective, but in talking about active dancers who we can arguably relate to an athlete, we're artistic athletes is what we like to say, but many of my youngest dancers are training up to 20 plus hours a week. So I'm curious to hear from you. At what point do you start to look for the average age when we want to see menarche?
It's a great question. So, first of all, dancers are athletes to the greatest proportion.
Yeah.
You guys are super active, super kind of go-getters, very high activity level. And when we think about menarche, so menarche is sort of the age at first period, we do very frequently see a little bit of a delay in the onset of a period. When we think about lack of periods, there are two different types of that. We call that amenorrhea. There is primary amenorrhea, which is where somebody does not get their first period, and secondary amenorrhea, which is an absence of periods after somebody has already gotten their first period, essentially. So usually it's 3 months not getting a period. We call that secondary amenorrhea. The definitions of amenorrhea have actually changed somewhat recently in that we consider a delay in primary getting a period if it doesn't happen by the age of 15 in somebody who otherwise has normal kind of signs and symptoms of puberty, things like breast development, axillary hair, like armpit hair, or an evaluation even earlier if somebody shows no signs of puberty at all. That age used to be 16 and was kind of recently lowered to 15. And a lot of things go into the mix with somebody getting their first period. And part of that is, body fat composition, activity level, family history, genetics, environment. We typically recommend, seeing a doctor about it if no first period at the age of 15 or older if it hasn't happened, whether or not somebody is active. So that age is not different in terms of the recommended workup, although somebody that is very, very active, that might be kind of an explanation as to why.
Okay, awesome. So what I'm hearing is for, all of my young dancers who might be 15 and still have not had a period, it's a plausible sign to say, okay, let me go speak to a doctor.
Absolutely.
Mm-hmm.
Absolutely. So at least get the workup, because it could be that they're super duper active and it just hasn't happened yet. But I also think it's really important that we don't just attribute all of it to the fact that they're very athletic and that they're dancers, because we want to make sure that there aren't other things, like other real things that can be happening that could potentially be explanatory. So we don't want to just chalk it all up to that. It is important to get the workup if it hasn't happened by the age of 15.
Right. And one other thing you said that I think is interesting is that as a clinician, you are also looking at other things that are going on, the onset of puberty and other characteristics of this too. So it sounds like having that workup it's not just about, did you get a period, yes or no? It's about actually maybe looking at the blood work and really evaluating multifactorial what might be going on.
Absolutely. It's really important to look at somebody as a whole and take a really good history, a good physical exam, a family history, ask about other things that might be happening, other stressors outside of what might be the obvious thing. And just sort of seeking the help of a professional who can kind of look at the big umbrella picture and try to figure out why it hasn't happened yet.
Absolutely. So my next question is, and I'm thinking of a lot of the dancers that I have worked with in the past who will either experience primary or secondary amenorrhea. We'll get them started with a new fueling plan, eating more consistently, and then this dancer will get a period, but that period will only last 1-2 days. So my next question for you is, what are we looking for, and how would you define what maybe a regular, I don't know if that's the best terminology, but what regularity is for, again, maybe a standard adolescent, but also an active, above average active adolescent?
That is a great question. So being an adolescent is very kind of stressful on the body at baseline. And normal periods, so once somebody gets their first period, they have achieved menarche. Periods often are not regular for anybody for sometimes even a couple of years. And that's not necessarily abnormal. That could be physiologic in people who are adolescents. But kind of outside of that range, when we think about a typical kind of average period cycle, you always hear about, oh, I've got a 28-day cycle, and people are worried that if it's not exactly 28 days, that it's not normal. The reality is there's a range of normal, and we typically think of that as being about every 21 to 35 days on average. And within that, people can be off a little bit month to month. So they might typically have a 28-day period, but every once in a while have a 32-day period or a 26-day period. And that's all considered in the realm of normal. If periods are, after the first couple of years after their first period, still experiencing, prolonged cycles, maybe not getting periods except for every other month or every 3 months, then that starts to be what we consider not normal or average.
Okay. Okay, that makes a lot of sense. And sometimes some of the dancers that I will work with will get that period, again, whether it's primary or secondary, and it kind of be this, a relief, yes, but also this, okay, I've done what I had to do, now can I go back to limiting my food intake or partaking in over exercising or disordered eating behaviors? And I want to hear from you to reiterate the importance of, this isn't like a check off the to-do list, right? Our body is constantly adapting, and we got to continue working on this, continue to support that metabolic environment.
Yeah. Dancers need a lot of fuel. If you think about, how much exercise, how active their bodies are, you need that fuel to feed the body, to make it healthy. And for bone health, period health, brain health, it's so critical. It's not just, like you said, a checkbox. It's something that's ongoing. You want to make sure that the diet has all of the components of it. Carbs, fat, protein, all of them are important. They all play different roles. And there has to be a certain percentage and a certain amount of body fat to tell the body that periods are okay, that we want to be able to get periods. The body senses that, and a healthy body fat, a healthy BMI, healthy percentages of all the different nutritional components are required for a healthy body. A period, in a lot of ways, is kind of like a vital sign. If the body is not getting periods for some reason, and one of those reasons could be that there's an imbalance between the metabolic needs of a person and what they're actually getting, then the periods shut down because the body is sensing that it's not getting enough of what it needs, and the periods are often something that goes first. But it very frequently is sort of a window to the health of the person. And when they're getting enough fuel and all of the different components that go along with it, then it kind of gives the body permission to act as it should. And one of the things that it does within that is getting a period.
Yeah, it's sometimes I say it's like a symptom of adequate fueling or good health. I mean, I'm sure that's also multifactorial, but I like that you said it's like a sign. That's such a good point. Are there any modifiable lifestyle factors that should be considered to help promote menarche if we have again, like 15, 16, maybe even older dancer who just hasn't gotten a period yet?
I think taking a really good look and taking a really good look at what that person is putting into their body, what they're consuming. Seeing a registered dietitian is really, really critical in this aspect because they might not be thinking about it in the right way. So somebody that's going to kind of look at the activity level, going to look at, food choices, not only again, what are the calories, but also what are the components of that food is really important. And then like any other lifestyle things, being cognizant of other things that you're putting in your body, whether that's like drugs or alcohol. Stress is really, really huge. I always say like stress is not going to cause amenorrhea for months and months and months, but there's a lot of not only physical stress that can go along with athleticism and people who are sort of very active, but there's a lot of mental stress as well. And those are the things that are kind of important to look at separately that can all kind of play a role. And so, I'm a fan of, mental health professionals there if needed. A lot of these things, dancers very often are see themselves as perfectionists and very type A. And sometimes having just an external person kind of looking in, not only in their physical health and what they're kind of putting into their body, but their mental health as well is really critical.
Yeah, all good points. And so much of what we reiterate here in regards to just looking at the whole being, right? Looking at mindset and food. One thing that you keep bringing up that I think is really important for us to talk about is body fat. And that it's not only a calorie thing, it's not only a calorie equation, that we do have to, when it comes to food, look at the multiple components. And I do want to hear more from you, from your perspective, about the importance of both fat on our plate, although I guess that's more, I can talk about that too, but from you specifically, the importance of fat on our bodies and what that is helping to promote, because fat in general is unfortunately so feared among so many dancers. And I'm often with most of the dancers I'm working with, it's one of our primary goals is to get them eating more fat and get them accepting more fat on their bodies. So I'd love to hear from you, from your aspect and perspective about this.
Absolutely. So fat is really important. And I feel like it has this super negative connotation in a lot of ways, when in reality, having fat is like critical to supporting our life. Fats make estrogen, and estrogen is one of the kind of female hormones, although everybody has it, that all kind of plays a role in, when periods come, how often they come, and whether they're normal. And the body has to have a certain kind of body fat percentage in order for all of the hormones that happen. There's the communication in the hypothalamus to the pituitary gland to the ovary. Having enough fat is required for that process to happen appropriately. And if there's an issue in any of those steps, the body is not going to develop a follicle. The body is not going to release an egg normally. If that doesn't happen, the lining of the uterus is not going to grow, and you don't get the signals to have that lining shed. So fat is really critical. It's kind of that permissive part that allows that to happen. And so it's not just kind of, like you said, what's on the plate, it's also what's in the body. One of the really hard things about people who have had periods and then stop getting periods, maybe they've decreased their BMI, they might not even be doing this actively, it just might be something that happens because they're so active. If you lose a period at a certain BMI or a certain body fat level, in order to get periods back, you sometimes actually have to get a little bit above the level where it was that you lost it. And that can be, I think, a little bit challenging for people, really for anybody, especially when you're thinking about body image and sensitivity level and things like that. It can be very challenging. But I think it's a really important kind of point to know, is that somebody is like, oh, I was like this weight or this BMI when I lost my period, I'm just going to get right back up to there and expect it to come back. And it doesn't always happen. And sometimes it can take a little while. You kind of have to maintain a certain body fat percentage in BMI in order for the body to recognize, like, hey, it's okay for me to get a period again. I'm good to go. And for that to actually happen.
That's really interesting. Actually, I didn't even realize that myself. That's very interesting.
Yeah.
I'm curious to hear from you now, looking into the future a bit. So we spoke a lot about menstrual health for our more younger adolescent dancers and what can be on the lookout for, reach in menarche, but also promoting more regular periods for as regular as they can get when they're first starting. But in thinking about our futures as we get older and thinking about the struggles of infertility, what would you love to leave dancers knowing about how they can help themselves, even obviously if they're not thinking about having kids anytime soon, but to just set themselves up for whatever success they might be able to have in that realm?
I love that question too. Not only because I do kind of fertility treatment every day, but because it's something that we very frequently see. And amenorrhea, lack of periods, are common among dancers, but it is also something that we see among people who are athletes in a different field or even in people who are not athletes. And one of the biggest fears is people will say, like, I'm not getting periods. I just know that I'm going to, have trouble conceiving a child. Or I'm so worried that this is something I always pictured myself being a parent or being a mom. And what if it doesn't happen? And there are lots and lots and lots of ways to become a biological parent if that's what the goal is. There are lots of kind of lifestyle changes that can happen. Some of it might be either decreasing activity level, depending on if that's a possibility, or intake if that's a possibility. And we're not even calories, just different kind of varieties of foods that you're consuming. There are also people who, by all kind of measures, you look at them, you check their hormones, you do, a really detailed medical history, and they're just not getting periods. There is just some disconnect between the hypothalamus in the brain, the pituitary gland, and the ovaries. Even in that situation, there are medications that can be given to talk to these ovaries and have them respond. Even if somebody doesn't have a functional pituitary gland at all, maybe they've had surgery, they've had an accident, they can still have functional ovaries with medications that we can give. Sometimes those are injections, sometimes those are oral medications, but there are lots and lots and lots of ways to treat amenorrhea if the goal is to have a biological child. A lot of what we do and a lot of what we think about depends on what the goals are of the person at that time. So oftentimes for adolescents, it's to make sure that, they're having adequate bone health. Their bodies are seeing enough estrogen to support their bones and support their brains and support their hearts. And they're not even thinking about having a baby. And then you have people who are maybe in their, 20s or 30s. And, maybe the priority before was just to, have periods, be like their friends, make sure they were healthy. But now they're at the point where they're ready to have a baby. The priorities are very different and therefore the treatments are different. And so it really depends on kind of where your patient is and kind of meeting them with what their goals are.
Mm-hmm. That's a really great point. And one question that I see was submitted here that I want to ask before we sign off, because it does come up often for a lot of dancers that I've worked with. But talk to us about the latest research behind previous recommendations for younger adolescents who have not had a regular period or who have not gotten a period yet, about oral contraceptive pills, and if that is still something that's done. Because I know at one point, or I guess always, the issue that we see from like a food standpoint is that it will help to bring on a period, but if that dancer is still partaking in restrictive eating, or just not, maybe it's not intentional restriction, just not meeting their needs because they're dancing so much, now they're getting a period because they're on the pill, but it's kind of masking the underlying issue. So I'd love to just hear your perspective on this as well.
It's a great question. So when you're on a birth control pill, essentially you're giving your body the estrogen and the progesterone that your body would typically make if it were getting regular periods. And so the way that the birth control pill works is that you're on, kind of estrogen and progesterone. And then when you're on the placebo pills, which are the inactive pills, your body is no longer getting that progesterone. And your body senses that, and then you have withdrawal bleeds. So the estrogen part of the birth control pill is helping to build up that lining. And then when you stop the progesterone part, it triggers the body to release that lining when you get a period. So you're right. You wouldn't know if a person kind of then was meeting their dietary thresholds for getting a period if you're on the birth control pills, because the birth control pills are going to take everything over. The reason that a lot of people get put on it is that if a person is, at an age where they would normally be seeing like estrogen when they're kind of cycling and they're not getting that, then it can potentially compromise the bone health, because the bones really, really thrive on estrogen.
Yeah.
And so it's not only, oh, I'm not getting a period, that's a problem. It's that's also a reflection of what the rest of your body is seeing. And so the adolescent age is this like really, really critical time for bone formation. Like we gain most of our bone density when we are adolescents in our 20s. And when you're not getting that at these really formative years, then you are at risk of developing things like osteoporosis and osteopenia later in life. And so that's the reason behind why you want to have some estrogen on board. Having a birth control pill is one of the options that can do that. There's other ones as well, cyclic estrogen and progesterone, but that's the reason for it. But you're absolutely right. If you are on birth control pills, you will be getting periods. You can be kind of tricked into thinking that everything else is okay in the rest of the body, and in reality, that might not be the case.
Yeah, that makes a lot of sense. And again, it just really goes back to this all being multifactorial, right? Like we would likely need that estrogen support for bone health, but at the same time, working with a dietitian, if needed, working even with a mental health practitioner to just ensure that you are supporting yourself as a whole being. This was such an invaluable chat. I cannot thank you enough. Really, you've given us so much information. I think I can pick your brain up on this topic for hours. I'm sure you can just sit here and answer questions for hours. This is what you do all day.
I love it though. I love it so much. I see, somebody asked what's the average age of a period? Average age in, the United States is about 12 and a half. We say somewhere between like 11 and 14 is most typical. Sort of early periods, that age is actually getting earlier and earlier just because of environmental changes. But, averages is around 12. But there's a lot of years that are still considered normal around that average of about 12.
I also saw another question here about actually calorie intake. Somebody said, is it true that I might need more than 2,500 calories a day? Yeah, honestly, a lot of the dancers that I work with who are, in the ages anywhere between 12 to even up to like 30, and you're an active dancer dancing more than 20 hours a week, absolutely, that 2,500 is often even just a minimum target. So
wow, that's a lot. And if you think about the energy expenditure during the day that you have, you really have to match that. And that alone can be a lot to think about. So even if it's something that's not happening like intentionally, it's like hard to sometimes maintain that and maintain it for your body. But it's really important to think about, and to, especially if you're a really active dancer, to have a registered dietitian and nutritionist kind of looking at everything, to make sure that you are taking the best care of your body that you can.
Yeah. And then I do have one last question for you to leave the dancers off with. Any questions they should have ready for when to see an OBGYN or just a GYN, any questions that they should come prepared with for that meeting?
Yeah. So I think having that age, like around 15, if you haven't got your period then, or especially if you haven't had like other signs and symptoms of puberty, that's a good age to think about going to see a GYN, or even a pediatrician at that point is kind of a starting point. But also you should feel empowered to go to the doctor to ask these questions at any time. So if you're worried about it, if you're concerned, if you're like, I don't look like my friends, or I, feel like I should have gotten my period already, I think to me is always comforting. So to know what the next steps will be, if this, then that, can be super helpful. And to just write everything down so that you don't feel like it's all in your head. You have to keep it there at the same time.
Yeah. So helpful. Randi, thank you so much for joining me today. Really, this was such a pleasure. You're an arsenal of information. Very, very helpful.
Thank you.
Have the best rest of your day, okay?
Thank you so much for having me.